Hello everybody, so today we will be discussing third degree burns by me. Okay, let's start by introducing third degree burns. So third degree burns are also known as full thickness burns. They are the most severe type of burn injury. For classification, these burns penetrate all layers of the skin, including the epidermis, the dermis, and the subcutaneous skin tissue. The significance of third-degree burns can cause extensive damage, leading to serious complications and requiring intensive medical treatment. So this photo to our right shows the three burns. We have our first-degree burn, second-degree burn, and third-degree burn. We're going to be mainly focusing on the third-degree burn that I'm circling right now. And these are the types of layers in the burns, and you can see that the third degree burn is worse than the first degree burn and the second degree burn. Okay, so now we'll be looking at cells in the skin layers impacted in the third degree burns. So first layer, we have the epidermis. So this is the outermost layer of the skin, and it's completely destroyed. Then we have the middle layer, which is the dermis. The middle layer of the skin contains nerve endings, sweat glands, and hair follicles, which are severely damaged as well. And then the last one, the subcutaneous tissue. This is the innermost layer. This consists of fat and connective tissue, is affected, potentially causing damage to underlying muscles and bones. As you see to the right, I have two pictures of our third degree burns. As you cannot see, it's pretty destroyed. The layers are labeled to the left, and we can see that it's worse than any other degree, and it just is damaged. The skin is like all damaged. Let's discuss the symptoms of the third degree burns. So for the appearance, the burn site may appear white, charred, which is like black or burned, and then leathery. For the sensation, due to the nerve damage, the burn area may be numb. And then other symptoms might include swelling, severe pain around the burn, which is in the areas where nerve endings are still intact, and potential shock. In this photo, I included this because we can see the hand in the third degree burn, and it's really swelled, and you can just tell that there's just the nerves are like intact and damaged. When it comes to treatment, I included immediate care, medical treatment, and long-term care. So for immediate care, they say that cool the burn with lukewarm water and then cover it with a clean cloth and seek emergency medical help. For medical treatment, this includes debridement, removal of dead tissues, skin grafts, IV fluids, antibiotics to prevent infection, and pain management. And then, of course, for the long-term care, physical therapy, rehabilitation, and possibly reconstructive surgery for functional and cosmetic recovery. This photo kind of represents what you should do and what you shouldn't do when you get a burn. So the forbidden, it says, do not add any cold water or ice. It will obviously make the burn worse. It says don't use toothpaste on the burn or like pop the blisters, and just don't stick anything on the burn. And then for what you should do, it says hold under cool water, like lukewarm water. Make sure it's not cold. Cover it with some kind of bandage, or even take some medicine reliever and call the ambulance or seek medical attention. And then on the top, it shows like what burn it is. And obviously the last one is our third degree burns or fourth degree burns, and what you should do in those situations is seek medical help. When it comes to environmental factors, heat sources can be direct exposure to flames, hot liquids, or steam can cause third degree burns. Chemical exposure, contact with strong acids, alkalis, or other corrosive substance can lead to severe burn. And then we have our electrical injuries, which are like high voltage electrical currents can cause deep tissue damage. And then safety practices, use of protective gear, safe handling of chemicals, and adherence to safety protocols can reduce the risk of severe burns. So these are my resources and where I got my information. Thank you so much for watching and listening to my presentation on third-degree burns. I hope everyone has a great day.